advance because my good camera is dead, and so we're just going through the GoPro, but I thought this was a cool enough surgery that it would be worth seeing even if you couldn't get the close-up view. So this is the dog that presented with a history of an abscess on the left side, kind of the left flank region that had been previously explored. They didn't find anything obvious, and the abscess has recurred. And so we went ahead and did a CT scan, and very excitingly, we found a satay skewer in the stomach penetrating through to the subQ space. So we're doing a midline abdominal exploratory. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So again, I'm sorry that you're not getting the great view that you normally get, but my camera battery is dead. It was left on by me yesterday, and so I can't even blame somebody else for it. That's really annoying. And so I tried to get it charged before we did the live stream, but it just couldn't get enough juice to be able to start the live stream. So you'll still get a little bit of a view, and I'll try to highlight the things that we're doing as we're doing them. So I'm doing a midline abdominal exploratory, a linea incision, and notice that I'm not going directly into the mass itself. I'm going into the abdomen, and the reason being that I need to be able to close the stomach. Number one, fully assess the stomach, and then to be able to close it. And if I came in through the side, I wouldn't be able to do that very effectively. So that's why I'm going midline. And I don't think this dog had been spayed. Did it have a spay incision?
Yeah.
It did, okay, it has been spayed. I was just going to say we might have to spay it at the same time. That would require a phone call to the owners, but since it's already spayed, we won't have to do that. Again, apologize for the bad camera view. I'm on my GoPro because my other camera battery is dead.
Someone is saying if the camera can be positioned a little bit different.
No. Yeah, no, I need to be able to see, and so this is the best you're going to get. I could try turning the brightness down maybe on the camera. Did we save the bag? Yeah. I can try turning the brightness down on the lights. That may help a little bit. Come around to the other light. Turn the brightness down on that one. That may just make it a little bit less washed out. But that's the best I can do. So we're just going to resect our falciform. Can we just blot there for me, please? Got some momentum in funny places here, and that's because the omentum has been trying to seal off what's happening with that skewer. So that is the greater leaf of the omentum that's attached to the stomach. Okay. So I just have to be careful that I don't poke this. All right, so I can feel the colon there. Actually, interestingly, the spleen has a big scar in it. Looks like that had potentially been penetrated. Just going to dissect up a little farther cranially. Bring that up a little bit further. All right, so I don't know if you guys can see that, but I can actually feel the skewer within the stomach right here. Go ahead and feel that, guys. Okay. So that skewer is poking up right there. Okay. Can you get a photo? You can use my phone if you want, or... Okay, so now I'm looking right down. So it's formed like a stoma with the body wall. Just missed the kidney. All right, so I'm going to have to try to dissect that down. You know what, can I get my loops, please? So that is just crazy. I'm just getting my surgical loop so I can get a better view down in that hole. Also might get the surgery table up a little bit, which might make it a little easier for you guys to see. And can I get the table up, please, as well? Okay, that's great. Thank you. All right, can I get your hand here and just pushing that kidney down?
Yep.
Okay, and then I'll take the cautery. Okay, I'm down onto the skewer. That's the satay. Suction's turned on?
Yeah.
Okay. What I'm going to do is pack some momentum up underneath my cut so we don't get any leakage.
Mia, would you mind helping to get a stool and place underneath mine? Thank you. Maybe you can just put it up this way.
Okay, so we've got the stomach out here now. What I'm going to do is I'm going to push the skewer into the stomach to try to get it out of that pocket. All right, so here comes the skewer there. All right, so that's the skewer right there. So go ahead and it wasn't even sharp at one end. Okay, so now can I get some 3.0 PDS maybe? And I'm just trying to release the stomach enough that I can get a look at that hole right there. Needle drivers, thank you. And we'll need a couple of extra hemostats, please. Yeah, go ahead and grab onto that. Cut above. And you can pull that over to your side. I bet even if I didn't close this, it would heal on its own. Yep. Okay. So now I'm just going to try to clean that up a little bit. So sorry you guys can't see this better. So I'm just cutting the omentum away here. Do you have something for us? Oh, extra hemostats? We're okay for the moment. Flip that over that way. All right. So I'm just dissecting the omentum away. There's some big vessels right there. And I'm just going to cut away that hole in the stomach. So I'll get some nice fresh edges. So the hole in the mucosa is actually really small. Let's just pack this off a little bit more so it doesn't leak. All right, and then I'm just going to close that hole in the mucosa. We did not see anything on we didn't take radiographs actually prior to doing the CT scan, because normally with a foreign body, radiographs are going to be pretty useless. All right, so I'm just closing mucosa here. So this will be mucosa and submucosa layer, with the submucosa being the holding layer in the stomach, as it is throughout the gastrointestinal tract. And then we'll grab something to probe with. So I can't get in there now. And then I'm just going to do a little simple continuous of serosa over the top. And again, leakage from the stomach after gastrotomy is not very common. Can you blot please for me? Okay, and we'll go ahead and cut our stay sutures down. All right, so now I'm just going to look at our hole in the body wall. Can I get another set of towel clamps, please? You can take your hand out there. Just lay this on top. Just see if any pus is... Yeah, there's pus coming out of there. All right, so let's get... a squeeze on that. You're a very lucky dog. All right, so what we'll do is we're going to get a catheter. Yeah, no, like a urinary catheter, like a big urinary catheter, the biggest one we've got. And I'm going to get some flush. I'm going to stick the catheter in there and then just repeatedly flush out the center of that hole. So I'm sticking this down in the hole where the subQ abscess was. Yeah, grab onto here, just a little bit deeper. Yep, and lift, see if you can lift up on that a little bit. Yeah, that's awesome. All right, so if you guys can't see, I'm sticking the catheter through the hole, or sticking the suction tip through the hole in the abdominal wall. And then I'm going to get a urinary catheter and stick it through the hole and flush, and then we'll just have the pool suction tip right below the opening. We'll keep this packed off so that we don't contaminate the abdomen. And then the next thing I'm going to do is get a pedicle of momentum and stuff it down the hole and suture it in there, and that's going to drain any pus or anything that's forming. So it's like omentalizing an prostatic abscess or something. All right, so what we can do is just put this here. It's funny, that hole is almost sealed already. Just gonna have to open that up a little bit more with some kind of instrument, maybe a hemostat. I've broken, that's too big probably. Yeah.
So a bit smaller.
Yeah, like a feeding tube or something, like a 18 French feeding tube. What I'm going to do is I will try to turn the camera on now, and then I'll just get new gloves. Okay. And just watch your head there. All right, I've just turned the camera on. So what have we got covered there? Yeah, all right, so we can see that now pretty well. I'll just come over that way a little bit. I'll turn the lights back up. And that one's all right. And just watch your head. Yeah, any one of them. I just need some new gloves, please. So I let the camera charge enough that I was able to turn it on. I might reposition it in a minute. I was trying to open up the hole and broke the hemostat. Let's see here if I point that up there a little better. And I zoom in. Oh, I just contaminated my glove again. Can I get another glove, please? Thank you. All right, so we'll just get Rita to really lift up on that abdominal wall. Okay. And pull it back a little bit more. All right, so that's the hole where that catheter is going in right there. That's where the satay skewer was. All right, so now we'll go ahead and get this a little bit lower down and flush. Oh, that may not be far enough in because there's still fenestrations that are sticking out. So I'll just pull it out, cut it off. So we have not had an issue with the thermometer and the cautery pen, to my knowledge. Okay, so that's flushing now. Just going to move the whole thing over here. I think you guys deserve a better view since the first part was so crappy. All right, so that's the catheter going into the hole. Hold on to that, please. I'm going to get you to flush that in just a minute. Okay, go ahead and flush. Yeah. All right. Now the scary thing is that this is right over the last rib, so it's possible that you could even get a pneumothorax. Just make sure we've got pressure, negative pressure on our, yeah, our diaphragm's fine. I don't know how, xiphoid is up there, I've got a little bit more room. Okay, go ahead and flush. Yeah. Okay. That's good. All right, that fluid is looking completely clear. Let's push on the side here. See if we get any pus out. We don't. All right, so I'm pretty happy with that. We'll get rid of that catheter. So the next thing we have to do is find a pedicle of omentum that we can jam down in the hole. All right, so here's a nice pedicle here. It's all adhered to the body wall. Just cauterize through this. And then we'll just get some thumb forceps, and I'm just going to feed the omentum into that hole. The idea being that it is going to be like the best drain in the world and drain any pus or bacteria that might be forming. If I can get it to go down there. And I don't want to enlarge this hole because I could be going through the diaphragm.
Do you need some fluid here?
I will, yep.
Mia, can you
Okay, so I've got that a bunch of omentum jammed down that hole. Let's keep that pushed over a little bit. And get some longer needle drivers. Question about the dog from yesterday. Doing well. That was Luna. So I'm just going to need that. Let's pull this out here. Having trouble getting the omentum to stay in there. It keeps just kind of shredding. Let me think about this for a second. Trying to enlarge that hole a little bit so I can get the omentum to stay in a little better. Where's my cautery, please? Dry gauze, please. Okay, so I've gotten that a bit bigger. And we'll try again with my omentum. Where's the pedicle that I had here? Lift that up a little bit higher, please, for me. Okay, that's a lot better. So I'm really trying to get a lot of momentum in there so it's going to be able to access the whole abscess. All right, so now what I need to do, and be careful suctioning, so we don't want to suck out the omentum that I've put in there. I'm going to need somebody on this side pulling that down. But not the omentum. Just, I need somebody to come around on this side, please. The dog from yesterday is doing really well. It's gone home today. Oh, careful, careful. That's all right. Okay, so just push that to the side gently. Yeah. Yeah. All right, so now I'm suturing around. Can we please get some warm saline ready?
Did you just do some suture to fix the omentum to the
Yeah, to tack it in place. Do we have any 3/0 or something on a bigger needle than that, please? O would be fine. Okay. All right, so we can take your hand out now, please, and release those guys there. All right, so now we'll just have to do a complete exploratory because I want to make sure that we don't have like a perforated bowel or something. So that spleen has a big scar in it. I don't know if you guys can see it, but that's probably where the skewer stuck into the spleen. Just going to zoom out now.
Not quite small. One table.
All right, so now we'll have a look at the diaphragm. So diaphragm looks good. There's a rib up there. Gallbladder, easily expressible. Stomach, we've already had a look at. Let's check our surgery site. Make sure we're happy with that. It's right there. That looks great. You can feel feces in the colon. A lot of omental adhesions all over the place. I can't even find the duodenum. There's duodenum there, so we'll lift that up here, make our duodenal basket so we can see vena cava right there. Hepatic artery, right adrenal gland, right kidney. The caudal duodenal flexure. getting into the jejunum. Come on, little jejunum. Come out and play. Okay. That all looks pretty good. So there's the ileum, right there, the antimesenteric vessel, cecum, colon. I'm not going to mess with this too much because I don't want to disrupt our omentalization. So our left adrenal gland is down there with the frontal abdominal artery vein sitting on top of it. That's the ovarian pedicle. That's the uterus back up in there. All right, so now let's flush. Just a second.
Finish the flop from still got 5 more.
Thank you. Okay, go ahead and flush. No, that's right. Dog's a little light. Dog is a little light. Breathing up a bit. Now, just keep suctioning there. Making sure I'm getting the linea alba. Which means white line. Leave that quite long. You can probably take that. Yeah, keep suctioning a little bit, but then take it out. Make sure the guts are all happy. Getting a little bit purpley. They're fine. Excuse me. Excuse me. When you're wearing a mask, you're supposed to sneeze toward the field. because the air comes out the sides of the masks towards your back rather than turning your head around so that you're sneezing actually into the incision. Just make sure that the intestines aren't being twisted. Now they're looking pink again. I think I had a little mesenteric torsion that would have worked itself out. But I'd like to see the intestines pink before I close her up. And I'm just getting the external rectus fascia on the point at which I deviated from midline. You don't have to get the muscle or the internal rectus fascia or the peritoneum. The other thing that I would have considered here is making sure that the dog was not anorexic before surgery. And if we needed to put in a feeding tube, and this dog was eating very happily, so yeah, crazy that a dog could have a hole in its stomach and a satay skewer penetrating the abdominal wall into a subQ abscess and still feeling good.
Potentially just like the damage from the skewer.
Yeah, I think so. So that spleen, I think, probably had been poked.
As well.
Yeah. Give me maybe just a little bit of slack on that suture.
Two OPDS or OPDS?
Two OPDS, please, for the subQ and intradermal layers.
Yeah. Emil, would you mind giving me a 2 OPDS, please?
quite long. Yep. All right, you happy to do subQ and intradermal? Okay, so I'll just make sure there aren't any questions that I hadn't answered. Oh, and for those of you that joined us recently, do you know where the skewer is? Here it is. That is the satay skewer. Right there. So that was what was doing all the damage. All right, so I will just go and check to make sure there aren't any questions that I hadn't answered. So the owners don't have any idea when it could have been ingested. I asked them about that. So yeah, my camera battery was dead, and so I had to go with the GoPro. I don't do surgery sitting down, except for very specific, very short cases. Post-op care is just going to be pain relief. We're not going to keep it on. Actually, we probably will keep it on antibiotics for a week. I do normally cover intestinal incisions with mesentery, and I stitch it to the wound. And the question about zooming in, you cannot zoom in with a GoPro unless you take it down and actually go through all the menus and stuff. And even then, it's a digital zoom. It's not an optical zoom, so it doesn't really help. All right, well, I'm going to go ahead and wrap it up. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream.